everyone! Good morning to all of you. My name is Danica C. Guarda, taking up Bachelor of Secondary Education, major in Mathematics. So, I am here today to discuss to you about the behavioral disabilities. First, I will tackle to you the definition of behavioral disabilities. What is behavioral disabilities? Behavioral disorders, also known as disruptive behavioral disorders, are the most common reasons that parents are told to take their kids for mental health assessments and treatment. Behavioral disorders are also common in adults. If left untreated in childhood, these disorders can negatively affect a person's ability to hold a job and maintain relationship. In the next slide, it shows the causes of behavioral disorders or behavioral issues. According to Clinical Partners of 2018, there are often several factors that can be responsible for why a child or teenager behaves in a certain way, which includes, first, genetic factors. We know that some children are more inclined toward behavioral problems because of their genetic makeup. A family history of mental disorders can increase this risk. Our first example is that a familial Alzheimer's disease. It is a hereditary and marked by Alzheimer's disease symptoms that appear at an unusual early age. Symptoms can start in a person's 30s, 40s, and 50s. The other example for genetic factors is familial FTD, familial prion disease, and genetic counseling. The second causes of behavioral issues is that other mental health conditions such as ADHD, autism, depression, and anxiety are often accompanied by behavioral problems such as shyness, anger, or school avoidance. The third causes of behavioral disorders is physical issues. It damage to certain parts of the brain can result in a child being unable to control some of their tendencies or being more inclined to aggression. For example, when you have a mental health problem and when you are an overweight or obesity. The fourth causes of behavioral disorders is bullying. Bullying or difficulties at school can result in a child acting out with aggressive or violent behaviors as a way of them dealing with their experiences at school. Examples are name calling. Name calling is when someone call your name in inappropriate word. Another example is that making fun of, making jokes at another's expenses, and unwelcome teasing. The fifth causes of behavioral issues is that the issues within the home, such as parental discord, family bereavements or illnesses, and parental mental health issues, can mean children and teenagers develop behavioral problems. For example, when you have a problem in your home and you cannot handle it, it can cause a behavioral disorder. The sixth causes of behavioral issues is that the difficulties learning acceptable behaviors from others, which can be because of learning difficulties or language problems. It can make it hard for children to learn socially appropriate behaviors. For example, if you cannot accept the fact that you are lost in game, you will suffer inappropriate behavior. And another example is that when you transfer in another school and you don't know what is their language, you felt alone and you cannot socialize with them. The seventh causes of behavioral issues is that if your child has experienced trauma or abuse, even at an early age, they may be more likely to develop behavioral problems. For example, being physically or sexually abused at a young age. Another example is that being hurt by your family member. The last causes of behavioral disorder is that alcohol and drug. Alcohol and drug usage can trigger behavioral issues within children. Parents aren't always aware their child is using drugs or alcohol, but research has shown the use of substances like cannabis can have a significant impact on your child's behavior. For example, when you are in a wrong friend, they can influence you to drink alcohol and use a drug. In the next slide, it shows the types of behavioral disorders. According to behaviordisorder.org, behavioral disorders may be broken down into a few types, which include the first types of behavioral disorder is an anxiety disorders. It differs from normal feelings of nervousness or anxiousness and involve excessive fear or anxiety. Anxiety disorders are the most common of mental disorders and affect nearly 30% of adults at some point in their lives. But anxiety disorders are treatable and a number of effective treatments are available. Examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder or social phobia, specific phobias, and separation anxiety disorder. The second type of behavioral disorders is the disruptive behavioral disorders. It is among the easiest to identify of all coexisting conditions because they involve behaviors that are readily seen such as temper tantrums, physical aggression such as attacking other children, excessive argumentativeness, stealing, and other forms of defiance or resistance to authority. Examples are aggressions toward other students or faculty, threats of violence, unyielding argument or debate, yelling inside or outside of the classroom, untimely talking or laughing or crying, and snoring in class. The third type of behavioral disorders is dissociative disorders. It involves problems with memory, identity, emotion, perception, behavior, and sense of self. It is a mental process where a person disconnects from their thoughts, feelings, memories, or sense of identity. Examples of dissociative symptoms include the experience of detachment or feeling as if one is outside one's body and loss of memory or amnesia. The fourth types of behavioral disorders is unemotional disorders. An emotional disorder is a mental disorder in which one's emotions are disturbed to a great extent. For example, a panic disorder, generalized anxiety disorder or GAD, separation anxiety, social phobia, specific phobias, OCD, and depression. The last type of behavioral disabilities is pervasive developmental disorders. The diagnostic category of pervasive developmental disorders or PDD refers to a group of disorders characterized by delays in the development of socialization and communication skills. Parents may note symptoms as early as infancy, although the typical age of onset is before 3 years of age. Examples are ADHD, autism spectrum disorder, cerebral palsy, hearing loss, intellectual disability, learning disability, and vision impairment. The last topic that I will discuss to you today is the treatments for behavioral disorders. Treatments for behavioral disorders focus mainly on behavioral treatments and medications. So I am going to tackle first the behavioral treatments. In behavioral treatments, there are two main types: parents management training and psychotherapy. In parent management training, it has been shown to work very well for children and teens with behavioral disorders. It is most effective when started early in childhood or the pre-teens years. But it is never too late to change the way you handle your child or teen's behavior. In psychotherapy, individual therapy or family therapy can also be effective in helping to manage behavioral disorders. Therapy can help change how a family functions and support parents and children or teens with figuring out the causes of challenging behavior and talking about other ways of handling them. Medication treatment for behavioral disorder is targeted towards treating underlying or co-occurring disorders such as attention deficit hyperactivity disorder or ADHD, depression or anxiety.